The AlterG treadmill uses NASA patented differential air pressure technology to precisely unweight a patient to only 20% of their body weight. Accurate progressive loading allows patients to practice normal gait mechanics with increased comfort throughout their recovery. Progressive loading and body weight support can be beneficial in treating a wide variety of diagnoses. Pain-free mobility with less stress on joints not only protects healing tissues post-injury or surgery, but it also enables longer sessions of physical activity for anyone who is limited by joint pain. Walking and running at a decreased body weight is also effective to work on endurance and cardiovascular conditioning. It's a great starting point for exercises for anyone with cardiopulmonary endurance or deconditioning. If moving easier with less pain is the goal, the AlterG treadmill is a great tool to help achieve that. To get started, it's important to select the appropriate AlterG short size. The shorts should be snug but not super tight. You can check appropriate size by referencing the AlterG short sizing guide. Patients who have difficulty standing or who are partial weight bearing should be seated when putting on the shorts. Shorts should also be worn over athletic shorts or other apparel. Avoid pulling up the shorts from the neoprene ring to prevent puncturing it. Step up directly onto the bag and utilize the side rails for support. A small step can also be added if the initial step is too difficult to navigate or perform a sit-to-stand directly onto the treadmill from a wheelchair. Lift the cockpit handrails until it's at the level of the greater trochanter. For more support and less pressure around the low back and hip area, raise it to the level of the iliac crest. You can record the cockpit height for different users using the markers on the side stanchions. Push the lock bar forward into the locked position and lift the bag straight up until both sides snap to the handrail magnets. Now you're ready to zip in. Make sure the zipper is attached all the way around to ensure a good air seal. When ready to begin, hit Start Calibration on the screen. Stand still on the surface of the treadmill and try not to hold onto or support yourself on any part of the structure. If your patient is partial weight bearing or has difficulty maintaining their balance, use the side rails for light support only. Remember, AlterG is the only body weight support system that actually measures the user's weight precisely during each use. Following these tips will help ensure accuracy during the calibration process. Once calibration is complete, tap Start Session to begin your workout. After the calibration is completed, you can begin the session by adjusting the body weight support on the main screen. Begin to increase the body weight support as necessary to achieve a fall-safe environment. Unless your patient has specific weight-bearing precautions, use the minimal amount of unloading necessary to achieve pain-free weight-bearing on the treadmill. This amount will vary for each individual depending on their specific limitations and goals of use. From the main screen, you can adjust body weight, speed, and incline. Select the speed and body weight support that allows for proper gait mechanics without pain. You can refer to our tip sheets for some suggestions on adjusting parameters for different patient populations. If your unit has the live video monitoring system, click the video button on the main screen to see the live video feed from the front camera that is mounted on the inside of the treadmill bag. At any point during the session, you can stop the treadmill belt by pressing the pause button. This will allow the bag to stay inflated and stop the treadmill belt only. This is a good option if your patient needs a break during the session or before exiting the machine. To resume the session, tap the pause button again. Once you have completed the session, press the stop button. Wait until the treadmill has come to a complete stop, unzip the shorts, release the lock bar, and lower the bag and cockpit before turning around to step off. The AlterG treadmill can be beneficial for more than just walking and running. The body weight support feature can be used to perform numerous therapeutic strengthening and plyometric exercises. Lower body strengthening, balance, proprioception, agility, and speed are all areas that can be addressed by performing exercises at a higher level with increased safety using the AlterG. Here are just a few examples of exercises that can be performed. Balance pads and discs can also be placed into the AlterG to help challenge a patient's proprioception and balance reactions. Bring the body weight up to 100%, unzip, and insert a balance pad without having to recalibrate the machine. You can work on higher level balance exercises and engage more of the visual system by zipping your patient in backwards as well. Optional Stride Smart Gait analysis software can also be accessed through the main screen. Tap on the Gait button to see metrics such as weight-bearing symmetry, cadence, stance time, and step length. These metrics will help you see the direct effects of body weight support, duration, speed, and incline on gait symmetry. They can help you justify treatment and create the perfect practice condition for treatment. Use the feedback from the live analysis to make real-time walking improvements. To create gait reports, click on Record Gait Data. We recommend creating recordings whenever a parameter is changed so that you can see the effects of that parameter on gait symmetry. For patients with scissoring gait, use the crossover gait button. And for analysis during jogging or running, switch to running mode for better accuracy. Pain levels can be recorded at any point during the session. Pain results will automatically be included in your end of session report. This is a great feature that will allow you to keep track of the body weight percentage and/or speed that pain is the lowest. Over the course of a few sessions, you can use these recordings to demonstrate an increased tolerance for weight bearing and note improvement. At the end of the session, tap Create Report and select the reports you want to email or save by tapping on the thumbnails you want to include. After you select your items, you can choose to either send the reports by email or export them to a USB drive. Make sure to select one of these two options before exiting the session, or else all data recorded will be lost. For more details on using the AlterG with various patient populations, check out the videos, case studies, and protocols under the clinical section on our website.